Bismillahirrahmanirrahim. Rabbi zidni ilma. Enjoy the little things in life because one day you will look back and realize they were the big things. Assalamu alaikum. My name is Dr. Sadia Rafiq and today my topic of presentation is parasitic diseases. Today I will discuss with you different diseases including Guinea, hydrated disease, Escadiasis and Drunculosis, their epidemiological triads, chains of transmission, clinical types, levels of prevention, global and national updates and recent advances. At the end of my presentation, you should be able to describe the epidemiological triads and the preventive aspects of these infections, would be able to explain the factors that contribute to their spread and the knowledge of the recent advances. First of all, teniasis. Teniasis pose a public health hazard in man, hence the growing need to understand the health implications of this endemic disease. Teniasis is an intestinal infection of human with the adult stage of the tapeworm of genus Taenia. The most important causative agents are Taenia solium and Taenia saginata, and their respective larva stages, Cysticercus cellulose and Cysticercus bovis. These are the shapes. Taenia saginata is like this sort of tapeworm, and Taenia solium is like this. Habitat. Adult worms live in the small intestine of their definitive host. Larva stage found in intermediate host tissue, and eggs are the diagnostic stage. Epidemiology. It is found worldwide about 50 to 70 million people are affected. Rural developing countries with poor hygiene. Places where pigs are allowed to roam freely and eat human feces allow the cycle to continue. Taenia saginata and solium pass their life cycle in two hosts. In man, the adult parasite live in the small intestine. The adult Taenia saginata measures 5 to 12 meters in length and maybe up to 24 meters, and solium measures to 2 to 6 meters. Their larval stage of Taenia saginata, which is Cysticercus bovis, mainly occurs in cattle. The pig is the main host for the late larval stage of solium. Cysticercus cellulose, but man may also be infected. This may lead to muscular, ocular, and cerebral cysticercosis. The adult stage of Taenia saginata and solium may persist for several years in infected humans. Mixed infections of both the parasites can occur, although the lifespan of Cysticercus cellulose is man is not known. It is suspected to be some years. It is a life cycle. As you can say, the man is a definitive host and the pigs and the cattle are the intermediate host. Saginata and solium, they live in the intestine of the human. The segments are the being shed and these are being eaten by the cattle and the pigs through the human feces. That's why then they become to the infective stage and developing the muscles of these animals. And when the man eats this uncooked meat of these animals, may lead to development of this disease. Mode of transmission through the ingestion of infected Cysticerca in undercooked beef in case of saginata and pork in case of solium, through ingestion of food, water, or vegetables contaminated with eggs. Reinfection by the transport of eggs from the bowl to the stomach by retroperistatal is considered to be rare. Incubation period is 8 to 14 weeks. Sign and symptoms. Most people are asymptomatic or with mild symptoms. Tapeworms can cause digestive problems including abdominal pain, loss of appetite, weight loss, diarrhea, and stomach upset. Most visible symptom is passing of proglottitis. What is these? These are the segments of the tapeworm which are passed through the feces. And rare is tapeworm segments become lodged in the appendix, which lead to appendicitis and bile duct cholangitis. Infection with solium tapeworm can result in human cysticercosis, causes sears and muscles of eye damage. Human cysticercosis. Human infection is caused by the ingestion of the eggs of the solium in contaminated water or food. It is called heteroinfection, or regurgitated eggs from the small intestine, which is called autoinfection. The eggs disintegrate and the infective stage leave the intestine via the hepatic portal system and are dispersed throughout the body where they develop to form cysticercae. Cysticercae that develop into central nervous system, which is called neurocysticercae, present a serious threat to the individual and even to the community if this condition is prevalent. As a result of mechanical pressure, obstruction, or inflammation, a variety of pathological changes are produced, leading to epilepsy, intracranial hypertensive syndrome, hydrocephalus, psychiatric disease, or even death. This is the document which is on web by WHO, in which they have said ingested solium eggs develop the larva, which is called cysticerca, in various organs of the human body. When they enter the central nervous system, they can cause neurological symptoms, including epileptic seizures. Taenia solium is the cause of 30% of epilepsy cases in many endemic areas where people and roaming pigs live in close proximity. In higher risk communities, it can be associated with as many as 70% of epilepsy cases. More than 80% of the world's 50 million people are affected by epilepsy live in low and lower middle income countries. WHO is working closely with partner agencies such as World Organization for Animal Health and Food and Agriculture Organization of the United Nations to promote animal interventions and meet the needs for interdisciplinary collaboration to control Taenia solium with the final goal to prevent human sufferings due to neurocysticercosis. Its diagnosis basically on direct fecal smear, brine rotation technique, and cellophane tape techniques. Visualization of eggs is with poor sensitivity and difficult to differentiate from saginata. The corporal antigen detection lies at 95% sensitivity and 99% specificity. In case of cysticercosis, if develops, the biopsy of the subcutaneous nodule, X-ray, CT scan, or MRI are used for the diagnosis of brain type, and ophthalmoscopic examination is used for ocular form. Histopathological diagnosis in autopsy tissue is also done, and differential leukocyte count shows eosinophilia. Treatment is with praziquantel 5 to 10 milligram per kg in a single dose. Niclosamide adult and children over 6 years, 2 grams single dose. Albendazole is also highly effective for treatment of cattle and the pig infection. Surgical removal is required for ocular and superficial cysticercosis. This was the incidence of TMO infection in human population of Swat, Pakistan. It was an occupational-based study was conducted to assess the prevalence of Taenia saginata and Haemophilus nana, tapeworm infections among farmers, education concern, and shepherds of the Swat. Out of 1014 individuals were examined, 21.2 were found infected with single or multiple infections, either with tame forms or mixed with helminthes or protozoan. Of the infected individuals, 7.39 were found to be infected by single species of tapeworms, or 13.8 had mixed infections. Next, come to the hydatid disease. Hydatid disease is zoonosis, a group of cystore infection which are important zoonotic disease of man. The disease in man is caused by the metacystosis stage, which is infective larva of the canine intestinal tapeworm Echinococcus. The adult worm are found in dogs and other carnivores. Epidemiological determinants. Aged is Echinococcus species, small tapeworms, rarely more than 7 millimeters in length. The scolex bear 4 suckers and there are 2 rows of hooks, one small and one large on the rostellum. It has different types. Echinococcus granulosus of worldwide distribution is for the most part maintained in the domestic transmission cycle involving the dogs as final host. In man, the infective larva causes hydatidosis, the unilocular type of echinococcus. The next is Echinococcus multilocularis is restricted to the northern hemisphere. It has been detected increasingly in the various countries like Iran and Turkey. In man, the metacystode causes the alveolar type of the disease. Then E. oligathus, a species occurring in the Central and South America, is suspected to cause disease in man. And last is E. vogeli, a species occurring in Central and South America, has been shown to cause polycystic hydatidosis. Host factors, uncontrolled slaughter of the food animals, indiscriminate disposal of offal and carcasses. Offal and carcasses are waste material of the animals, and eating habits of the people play an important part in the epidemiology of the disease. Human infection is acquired usually in childhood through contact with infected dogs. Hydatid disease is an occupational disease of certain groups like shepherds and their families in endemic areas and shoemakers. Echinococcus granulosus, also called dog tapeworm or hydatid worm, belongs to Cloxistoda. It causes cystic echinococcuses or hydatid disease in livestock and human beings, which act as intermediate hosts and parasite the small intestine of the adult canids. Canids are the animals which are dogs, wolves, foxes, and jackals. These are their definitive hosts. It is a zoonotic disease. The adult worms lives in the jejunum and duodenum of dogs and other canine carnivora like fox and wolves. The larval stage, which is hydatid cyst, is found in liver and other visceral organs of humans and herbivorous animals like sheep, goat, cattle, and horse. Its life cycle passes through the two hosts. One is definitive host, which is dog and canine animals, and the intermediate host, which are sheep and other herbivores. Man acts as accidental intermediate host, which is a deadhead. Mode of transmission is man and other intermediate hosts acquire the infection by ingestion of food contaminated with dog species containing eggs. Rarely, flies serve as a mechanical vector of the eggs. Incubation varies from the months to years depending upon the number and location of cysts and how rapidly they grow. Development in man. Eggs transform to larva, hydrated cyst basically. In duodenum of man or sheep and cattle, the oncosphere is released by the rupture of ova. Oncosphere hatches and penetrates into the intestinal wall, enters the portal circulation and carries to the lips 60 to 70% of the cases, or lungs, or rarely to any other organ. Host immune response may destroy many oncospheres, but few may escape destruction and develop into hydrated cyst. The oncospheres are encysted by the fibrous tissue produced by the fibroblast and transformed into fluid-filled bladder-like cysts caused as hydrated cysts. The hydrated cysts undergo maturation increases in. This is the life cycle. As we can see, the dogs are the definitive host and the sheep and the cattle are the intermediate host. And this cycle goes like the ingestion of the eggs in the feces, and this cycle goes on. And when a man is the accidentally intermediate host, and when it goes inside the human body by the ingestion of the egg or the larva, then it develops further, leads to the formation of hydrated cyst. Pathogenicity is related to the deposition of the hydrated cyst larva form of the parasite in various organs. Fully developed hydrated cyst E. granulosus is uninocular, subspherical in shape, and size varies from few millimeters to more than 30 centimeters. It appears as fluid-filled bladder-like cyst. Clinical features: infection usually occur in childhood but gets manifested in adult life. Site: most common site of location of cyst is liver 60 to 70%, the right lobe, or lung 20 to 30%, but may be found in any organ like spleen and kidney, brain and heart, and rarely bones. They grow up to 5 to 10 centimeters side within the first year and can survive for years or even decades. Asymptomatic. Many cases are asymptomatic and infection is detected only incidentally by imaging studies. You can see the hydratis is a macroscopic picture of this, and the surgical resection from the liver shows this hydrated cyst. Laboratory diagnosis skin test. It is called Cassoni's test. It is an immediate hypersensitivity reaction to hydrated fluid antigen developed by Cassoni in 1911. In this, the sterile fluid is used. It is the antigen 0.2 ml is injected on one arm, and we see the development of the formation. 5 centimeters, the wheal appears on the arm, and then we compare it with the 30 minutes and wait for the second arm for the reaction. It has low sensitivity of 68 to 80% and also gave false positive results. So nowadays this test is obsolete and it is now replaced by the serological tests. Antibody detection, screening tests. Various antibody detection methods are evaluating using crude agranular cyst fluid antigen. They show variables of 60 to 90%. These tests are indirect heme agglutination test, latest agglutination test, indirect fluorescent antibody test, and ELISA. Confirmatory tests: immunodiffusion and electroimmunodiffusion, Western blot detecting antibody against antigen B fragment. This test is 92% sensitive and 100% specific. Antigen B fragment binds specific to IgG4 antibody. Patient will liver show better results. Treatment is the surgical removal of the hydrated cyst. 90% effective but can be risky depending on location, size, and advancements of the cyst. It may need chemotherapy to prevent recurrence. Chemotherapies with albendazole is preferred treatment because it penetrates into the hydrated cyst. Dosage is 10 milligram per kg body weight or 400 milligram per to do daily for 4 weeks. Albendazole is also can be given. And dogs are effectively treated with praziquantel. Peer treatment, which is specific for the hydrated cyst. It is puncture, aspiration, injection, and re-aspiration. It is alternative method recommended instead of surgery. It involves 4 basic steps. First of all, the percutaneous puncture of the cyst, then the aspiration of 10 to 15 ml of the cyst fluid, then the infusion of scolicidal agents like hypertonic saline and certamide, and the re-aspiration from the cyst. Prevention and control. Preventing dogs from gaining access to raw offals at slaughterhouses and farms and to dead animals. This involves control of slaughterhouses, proper meat inspection, and destruction of infected viscera. Then the control of dogs. This involves elimination of stray dog, drastic reduction of the dog population, and effective dog registration system. Surveillance of dogs based on periodic stool examination after administration of Tenia fuge. These are the medicine which are used to expel tapeworms. And then the single dose of 5 milligram per kg of body weight will remove all adult worms from the dogs. Health education of the public, particularly butchers, dog owners, animal breeders, and shepherds, is the basis of effective prevention. So this is the again the complete life cycle. It shows the dogs are definitive host, man and sheep are the intermediate host, and by the eating it spreads like this, and the cycle goes on. It is for the one of the article, the spread of cystic gynococcus in Pakistan due to stray dogs and livestock slaughter habit. It was the data was collected from 123 butcher shops in Rawalpindi, Islamabad, Pakistan. The slaughter rate in the butcher shop 2 to 10 animals per day, including sheep, goat, cattle, and buffaloes. The overall prevalence of the this disease or examined was 2.77%. The buffaloes, the high prevalence was recorded as compared to other hosts. The findings showed that lung and liver were most effective organs, and majority 59% of subscribed were fertile in infective animals. The presence of large number of stray dogs were an important factor in the spread of this disease, and they were rarely vaccinated, have easy access to infected offers at slaughtering site, and insufficient and inappropriate anthelmintic treatment. Conclusion was the most pressing need is to raise public awareness of this huge problem by considering echinococcus a major ailment and promoting the collection and mapping of epidemiologic data. Efficient control is required, especially treating dog with antiparasitic drugs, for which government support and affiliation with the veterinary sector is essential. Next is Escadiasis. Ascarius lumbricoides is the largest nematode roundworm parasiting the human intestine. It is an intestinal worm found in the small intestine of the man. They are more common in children than adults. As many as 500 to 5,000 adult worms may inhabit a single host. The most common soil transmitted human helmintic infection, estimated 807 to 1,221 million people are infected worldwide. Worldwide distribution and affect the poorest and most deprived communities. Highest prevalence in tropical and subtropical regions and areas lacking adequate sanitation. Morphology. Elongated ciliary, stapling and goat heads, segments are separate. The female is longer than male with 35 centimeters long, 4 to 6 centimeters in diameter. Male is smaller, means 30 centimeters long, 6 centimeters in diameter. The posterior end of male skull having peanut setting near the ends. The mouth opens at the interior, which is surrounded by three finely toothed lips. The Thank you. The mouth part, it is surrounded by three finely toothed lips. The lips are on dorsal and two ventral lateral. Three lips bear sensory structure called labial papillae. It occurs when the man swallows the infective eggs of Ascaris with contaminated food or water. It is the shape of the egg of the Ascarius. It is a life cycle, as you can say, it is the female, which is longest side, male is the smaller side. It is when it is ingested, it goes feces contaminated, unfertilized egg will not go biological development. The fertilized egg and goes to the water develop, and when the man with the contaminated water and food is being ingested, and it goes inside the and this how this the life cycle goes on, and you can see there is no intermediate host in it. Adult worms lay in the lumen of the small intestine. A female may produce approximately 2 to 20,000 eggs per day, which are passed with the feces. Unfertilized egg may be ingested but are not infected. Fertile eggs embryonate and become infected after 18 days to several weeks. After infective eggs are swallowed, the larva hatch invade the intestinal mucosa, carried by the portal, then systemic circulation to the lungs. Larvae mature further into the lungs 10 to 14 days, penetrate the alveolar wall, ascend the bronchial tree to the throat, and are swallowed. Upon reaching the small intestine, they develop into adult worm. Between 2 and 3 months are required from injection of the infective eggs to oviposition by the adult female. Adult worms can live 1 to 2 years. Symptoms: stage 1, worm larvae live in the bowel, attached to the bowel walls. Stage 2, worm larvae migrate to the lungs, fever and breathing difficulties, coughing and pneumonia. And stage 3, worm enters in the small intestine and mature into the worms and remain there to feed. Abdominal system or abdominal comfort and intestinal blockage. It could be maybe partial or complete. And partial intestinal blockage or total intestinal blockage leads to severe abdominal pain, vomiting, restlessness, disturbed sleep, worm in stools, and worm in vomit. Clinical features include abdominal pain, diarrhea, vomiting, and slight temperature, a blocked intestine and appendix. It may either bile or pancreatic duct interfere with digestion. injure the intestine and cause peritonitis. They produce toxin which irritates the mucous membrane of the gut or prevent digestion of proteins by host by destroying an enzyme trypsin. In children may cause stunted growth and makes the mental capacity dull. Larvae cause inflammation and hemorrhage in the lung which results in pneumonia, may prove fatal. Treatment can be easily treated with number of antihelminthic drug. Parental pamoate given as a single dose of 10 milligram per kg, levamisole given as a single dose of 2.5 milligram per kg, mebendazole and albendazole, respectively. Prevention and control. Keeping good sanitation condition is the only way to prevent the infection of Escadiasis. Pollution of soil with human feces should be avoided. Vegetables should be thoroughly washed in a mild solution of potassium permanganate and properly cooked before use. Fingernails should be regularly cut to avoid the collection of dirt and eggs below them. Hands should be properly washed with some antiseptic soap before touching edibles or eating. WHO strategy for soil transmitted helminthing infection. People who are at risk are preschool age children, school age children, and women of childbearing age. WHO recommends periodic treatment for anti-helminthing deworming medicine to all at high risk living in endemic areas. Treatment should be given once in a year when the prevalence of the soil transmitted helminthing infections is over 20% and twice a year where it is above 50%. Along with it, health education and provision of adequate sanitation. This is 2030 targets of soil transmitted and helminthiasis control programs by WHO. It is the neglected tropical disease, and the neglected tropical disease roadmap published by WHO in 2012 set two targets for the control of soil transmitted helminthiasis by 2020, namely 75% of the preschool and school age children in need of treatment are regularly treated, and 75% coverage of preventive chemotherapy is achieved in preschool and school going children in 100% of the countries. In parallel to increase the coverage, there has been additional important achievement. It is estimated in 2015, soil transmitted helminthiasis control program averted the loss of more than 50,000 disability adjusted live years daily in preschool and school going children out of the total 13 lakh daily that would have lost without such programs. Several countries have already completely eliminated morbidity by this infection. Furthermore, a number of countries have conducted this program for more than 5 years and are evaluating their epidemiological impact in terms of morbidity. Last one is drunkenculiasis. It is also known as Guinea worm disease. Vector-borne parasite disease caused by the nematode roundworm Dracunculus medinensis, also known as Guinea worm. Dracunculus medinensis, little dragon from Medina, drives its one-time high incidence in the city of Medina. It was described in Egypt in 15th century. It is not lethal but disable its victim temporarily. Problem statement, as we can say, from starting from 1990, it has 3.5 million cases, and by the passing time, the number of the cases declined drastically. In 2005, there were total 22 cases, 9 in Chad, 3 in Ethiopia, and 5 in Mali, and 5 in South Sudan. And again, you can see the decline in the graph, number of the cases and the years it is being declining, and by 2018, 30 cases were reported. Agent, Dracunculus medinensis, it is a roundworm. Adult parasite inhibits subcutaneous tissue, mainly of legs and feet. Female worm is 55 to 120 centimeter long, while male worm is 2 to 3 centimeter long. Host factor, man is the definitive host. Multiple and repeated infections can occur in the same individual. Environmental factors, it has seasonal pattern. Unsafe stagnant water includes ponds, pools in dying liver beds, shallow uncovered wells. In dry regions, people generally get infected during the rainy season when stagnant water is available. And in wet regions, people get infected during dry season when surface water is drying up and becoming stagnant. People get infected with Guinea worm by drinking stagnant water containing copepods, which are the tiny water flies that carry Guinea worm's larva, which is the immature form of the worm life cycle. The digestive tract kills the copepods, releasing the larva. I have told you copepods is a water flea in which the larva is present. And when the digestive system kills the copepod, releasing the larva. And it is the life cycle of the Guinea worm. As you can see, it is in the lava ingested by the stagnant. When the person drinks, individual humans drinks the stagnant water, it has the lava in it and goes inside the human body. And then the lava goes subcutaneously, and then it comes to the adult from the different parts of the skin, usually from legs and the feet. Sign and symptom: intense burning pain localized to path of travel of the worm, fever, nausea and vomiting, and allergic reactions. Arthritis and paralysis due to death of adult worm in joint. Skin blisters, which even rupture, form skin blisters. Adult worm produced from these ulcers. Mode of transmission: disease is transmitted entirely through the consumption of water containing cyclops, harboring the infective stage of parasites. It is totally water-based disease. Prevention and control includes the surveillance, which includes the case detection and case containment, provision of safe drinking water, vector control by using a chemical larvicide, and health education. Prevention is prevent people from drinking contaminated water by using water from the borehole, boiled water, filter all drinking water by using mesh cloth, piped water, and treated water so they will larvicide. You can say simply if they put the mesh cloth over it, they can the water can be drinkable after this by the removal of the cyclops. Optimal management of Guinea worm disease include following steps. If the person has this infection, then and there's a blister or infection on foot or something, immerse emerging worm in buckets of water to reduce number of larvae in those worms and discard this water on dry land. Because if the person when the person because of the irritation dips its foot or in the water, the larva comes out from the water and the quantity of the larva in the body decreases and it gets relieved by the patient. Then discard that water and then clean the wound. Rod of Asclepius. Worms are removed by rolling them over small stick to provide extraction and slipping back. In this, a small like matchstick is just rolled as this is shown in the figure. The thing is so give a small traction force to the worm. So it may put up because it is number of time 100 sometimes centimeters long and to prevent it slipping going back again the body. So this procedure goes for sometimes days to weeks to get the full extraction of the worm from the body. Then topical antibiotics to prevent any secondary bacterial infection, then the analgesics for the pain relief. These steps are repeated every day till whole worm is pulled out. Guinea worm reduction program in Pakistan. Pakistan eradicated Ranculiasis from the country in October 1993 after a national campaign which began in 1987. It was also the article available, Eradication of Ranculiasis from Pakistan. The National Institute of Health Islam and the national coordinating body for eradication of Guinea worm disease from the country. The program in Pakistan is being financed by the Bank of Credit and Commerce International. In the first phase of the program, which was initiated in 1987, epidemiological surveys were carried out through the country. A total of 401 villages with an estimated population of 361,005 districts of the country reported having Guinea worm disease in the preceding 3 years period. And this is the data of the district, Banu, DI Khan, DG Khan, Tharpak, Sangha total, and the total number of villages, cases per year, number of cases, then the number of cases less than tier per year. It is the data from 85 to 87. In the second phase of the program began with the onset of 1998 disease transmission season. Intensive efforts to eliminate the disease has been initiated on all endemic villages of the countries. These include epidemiological surveillance, provision of special nylon filters to all households in the endemic villages, monthly application of abate, a 50% preparation in oil or rainwater ponds that were being used for drinking water purposes, and the health education. Then the interventions which were done further deploy effective vector control, heighten surveillance, detect and contain cases, improve access to safe drinking water, promote health education and behavior changes. Following activities are continuing as per recommendation of International Commission for the Certification of Drunkuliasis Eradication, ICCDE, which includes health education, rumor registration and rumor investigation. Maintenance of Guinea worm disease on list of notifiable disease and continuation of surveillance in previously infected areas. Careful supervision of functioning of hand pumps and other sources of safe drinking water. These are the references. Now it's the time for the MCQs. The most prevalent tapeworm infestation present in Pakistan is Typhalobothrium, Mara lapis nana, Taenia saginata, Taenia solium, Phanerococcus granulosus. Yes, it is the Taenia saginata because it, as I have told you, it is present in the uncooked beef. So if the food is not properly cooked, it may lead to this disease. Simplest measure to control dracunculosis is chlorination of water, boiling of water, use of
B.
no, it's three. I've told you. Filtration through a cloth is a simple way because we have the cyclones which are being filtered on it by just putting a bash and pouring a water on it. So the easiest simplest measure is to filtration through a cloth. The definitive granulosis is man, cattle, fish, dog.
Dog.
Dog is the definitive because it is present in a relationship between one organism live in or fall under the injury to diseases, infestation, infection, commensalism, parasitism, and symbiosis.
Parasitism.
Okay, ma'am. The relationship between an organism live and mutually beneficial
Symbiosis.
symbiosis. And the third relation, I just want to, if the both organisms the second organism is neither beneficial nor harm, then it is called commensalism. Roundworm, nematoda, trematoda,
Nematoda.
nematoda. Yes. Anemia in children occur due to infestation of round
Bookworm.
and intermediate dose is not required. Yes, excellent. I have told you because the contamination of the eggs, there is no intermediate dose required. Tuberculosis by drinking water which contains
D.
cycles. Yes. Tinea solium can be treated by ingestion of poor eggs, beef, pork, fish. This is the key. Thank you so much. Thank you so much.